Hello, it's Elfrida here. I'm just going to talk through how to do a frailty review fairly briefly. The reason we're sending this to you is because we know that you do lots of dementia reviews and learning disability reviews. So actually, we are hoping that when you're seeing these patients in person, you will also be able to tick some of the requirements for a frailty review because there's a lot of overlap. Now, as part of the ECF, we're trying to increase the prevalence of frailty. So we still want, whenever you see somebody who's 65 and over, or who you suspect may have frailty, to record a Rockwood score. But once we've got lots of Rockwood scores, we'll be able to assess how many of these patients are moderately or severely frail. And these patients need to have an annual review. So you'll see here, these patients need to have a Rockwood recorded, a carer status documented, a FRAT assessment, a loneliness score, and also for those with moderate or severely frailty taking more than 8 medications, they also need to have what's called a polypharmacy medication review. So if I just move the camera to EMIS, I'm just going to open the frailty template. So the template's actually called Frailty and Over 65s Review. Make sure it's the Ardens template. When we open this, very helpfully, the first item in the list has got this little star, and that means it's relevant to our ECF and our ICB. So this is the only bit you need to look at in terms of the requirements for the ECF. Now, again, it's got the bits that I'd like you to complete. So the Rockwood score, 1 to 9. Have a quick look at the diagram if you're not sure, and you'll soon get familiar with the sort of different mobility and ADL functions that fit with each level. Whether the patient's got a carer or not, which I'm sure you record already. These items, the FRAT score and the UCLA loneliness scale, might be new to you. So the FRAT score is all about falls risk. For this, you need to assess 5 things, and actually you can normally do this from the notes and just from your knowledge of the patient. So the questions are: any falls in the last 12 months? Are they taking more than 4 medications? Do they have a diagnosis of stroke or Parkinson's? Any issues with their balance, and can they rise from a chair unaided? Now, essentially if they score 3 or more, they are at high risk of falls, so you do need to do something. Now, depending on whether you're doing things anyway, you may have time to do a lying standing blood pressure, or you may be deprescribing. Often these patients might benefit from seeing the social prescriber to talk about things like emergency buzzer. Also, there is a comprehensive geriatric MDT that you can refer patients to via CHLCH, and the form's on DXS. So there's quite a lot we can do. If they're at high risk of falls, I always consider bone protection as well. So you might want to calculate a FRAX score, or consider whether they need ADCAL, for example. So I'm going to actually send you all another document that's got a bit of information about FRAT scores and the loneliness scale. The loneliness scale is assessing loneliness, and you score each item 1 to 3. Again, I don't necessarily ask them these questions specifically. You can get a feel for what they might score based on chatting to them, but the questions are: how often do you lack companionship, feel left out, or feel isolated from others? And again, if patients are scoring highly, above 6, you do need to do something. So whether that's asking Irene to give them a call, whether it's discussing whether medication would be helpful, or a referral to the wellbeing team. For this older population, often it is to do with social isolation, so the social prescribers are really helpful with this in terms of charities and befrienders and other services that might be available to help them. Now, if you're a clinician, it'd be amazing if you could also look at the medication side of things. Those patients taking 8 or more medicines, as I say, should have a polypharmacy review, and all we really need to do is tick this box. But as part of doing this properly, we should be calculating an anticholinergic burden score. This you can just find on Google. Just trying to find it now. But it's not, there's a really helpful ACB calculator. So you put in their medicines, ones that you think might be anticholinergics, and then it gives you a score, which is really helpful. And obviously, if they're getting a high score, you need to think about whether they really need that medication. The ones that are really easy to stop are things like antihistamines or medications for incontinence, which often when people are older, they're using pads and things anyway. And certainly it's all about deprescribing these days anyway. So if you're deprescribing, definitely tick optimizing medication. things that we often stop are things like statins, PPIs, if they've been on for years and there isn't really an indication. And also, I guess in dementia, you're thinking about whether they're still going to benefit from anti-dementia medications and things like that as well. So that would be great. If they are very severely frail, you might want to record a GCF status as well. So I hope that's helpful. I'm just going to show you the other document that I will send you, which is about frailty assessments. This is about the full frailty review. So it's obviously quite detailed and focuses on ADLs and skin and vision, but you don't need to do all of this. You'll cover quite a lot of this in your normal reviews. Nutrition is something to consider, but we always go for food first if we're concerned someone's getting malnourished, and emphasise protein and regular weight-bearing exercise. I quite like to agree some goals with the patient, and definitely consider signposting. So this is often a very holistic MDT approach to managing these patients. We do actually have an MDT, so if you do think a patient would benefit from that, you can see on here, the document I showed you sort of fits with the Ardens template, but the MDT approach, we tend to write in some goals and talk about the further referrals, and that takes place, I think, every couple of weeks with a social prescriber, a pharmacist, and one of our advanced nurse practitioners. But yes, I'll also send you this, which has got a bit of information on, again, on FRAT, Rockwood, the loneliness score, and a must score if you're worried about someone's nutrition. Anyway, thank you for your patience watching this. Any questions, feel free to come to me.